So speaking of remote nursing,
Right? That's one of the skill sets you do learn. I mean, I've been doing remote for what, 6 to 8? No, wait, let's see, 2008, 2000. I've been doing it for 18. I can't, 17 years I've been remote. And so, you do learn. That was one of the first things I had to learn was computers and emails because it was 2008. Not everything was remote at that time. So,
no,
you know,
you were remote before it was popular to be remote.
you're exactly right. Yes. And so
You're
as a
like OG.
right. I love it.
You're OG remote.
OG remote. I love it.
Well,
Great.
before we jump right in, I have had you on the podcast
Yes.
before, but
Yes.
not talking about this subject.
Right.
And for those of our wonderful audience who do not know who you are, Felicia Sadler, uh, give us just like a little bit of like a bio light about just like who you are, how long you've been a nurse, and what you're currently doing, and then we'll jump into talking about what does remote nursing look like.
Right. I love it. Yeah, no, it's our profession has just expanded. I mean, I feel like it's on steroids now, right? Because we have so many opportunities. But just to give you a little bit of historical background, I've been a nurse for a very long time. We'll just say over 30 plus years, and I'll leave it at that. And really came out of nursing not knowing or understanding what the profession truly was. I mean, I knew from very early age I wanted to be a nurse and not understanding kind of the whole realm. The only exposure I had was really my own, as a pediatric patient, but also through television. You get those idealistic presentations of nursing. I just knew I wanted to help people. And I committed to that at a very early age, did a lot of volunteer work. When I graduated, still didn't understand fully the profession. I just knew my idealistic view of it and quickly learned what nursing truly was. I had a great education program, came through a diploma program, so certainly I had a lot of experience through that and grew and had wonderful mentors and preceptors along the way. Ended up raising a family initially. So I committed, very early on to raising a family and trying to find roles that really align to that family work-life balance, if you will, getting the hours and what you needed to be able to effectively raise a family, being able to have spend time with your children and your family. So through that, I midlife, if you will, went back to school and finished up my bachelor's, finished up and pursued my master's of jurisprudence and health law. Wanted to really do something a little bit unique outside the typical traditional, what we think, MSN, and nothing against that. I think it's great. I just wanted to choose a little bit different trajectory. Passionate about quality, patient safety. And then I went on to then become a CPHQ and a Lean Six Sigma black belt. I just couldn't stop myself. I could not. I was just on a roll, right? I was in the zone and wanted to just go there, and I did. And but now I understand.
What is that? Wait a minute. Hold on. Back up for a second. You
I
have
was
to
crazy.
you can't just throw those things out there and then just gloss over it. I'm like, wait. We have to just explain that a little bit more.
Yeah. Well, I got the itch, if you will, just to really do more. I always wanted to be, wanted to pursue my clinical nurse specialist when I was in my 20s and just things that didn't happen. And at a moment in time when I was just kind of on a roll, I thought, okay, this is an area of interest for me. I want to be certified. I want to be a certified professional in healthcare quality. As I was learning, going through my master of jurisprudence, I started learning about the regulatory drivers. I thought, I really want to embrace this world of quality and really be committed to the world of patient safety. And so that I really started pursuing that. Through that, I started really wanting to to embrace um, the core principles and core elements of Baldrige, which is really, high reliability, things that are really, healthcare is really foundationally focused on. And so, as part of my Lean Six Sigma project, it was to go in and learn and study the Baldrige core elements. I actually became a Tennessee Center for Performance Excellence trained in Baldrige principles. Where I actually had to go in and survey institutions. And so, I mean, I can go as deep as you want to in all these
Wow,
areas.
that it's just amazing.
It, I just became very passionate about it. Now I feel like I'm in a place remotely where I can give back. Like I've really learned and really inundated and immersed myself in all of those areas, and now I feel like I'm able to give back in those areas. I will tell you a side story on the Lean Six Sigma, because you're like, why Lean Six Sigma black belt, right? Um, as it relates to pursuing that, I really wanted to know, could I do this? I'm a very big picture, strategic, kind of at the organization level person. I'm not in the details or in the weeds, or I don't enjoy it. And I'm like, could I even do it if I wanted to? So that's why I pursued Lean Six Sigma Black Belt. I wanted to see, could I do this? And so it was just kind of on my bucket list as part
That's
of it.
amazing. I'm always in awe of people. I know people, sometimes will say the same thing to me. They're like, "Oh, wow, I'm amazed, like the things you've done and this and that." And
Yes,
I think we minimize
we do.
our own stuff. Like it
Yeah,
just seems like it's not that big of a deal, or oh, but it is. It is a big deal, and it ties in really nicely to the
yes,
fact that when you become such a subject matter expert in certain areas and you take the time to do what you did and to learn the things that you learned, that it opens up the world for you in a
it
different
does.
way.
Yes,
And suddenly you are able to do these things like be a
right,
remote nurse,
right,
because what is it that someone needs? They need what's in your head. They
right,
need that information. And you don't have to physically be somewhere to
right.
share what's in your head,
Yes,
right?
right. It's through your education, your experiences that you gain, you become seasoned in those areas, and then you can give back and contribute in and expand your career growth path as well.
Yeah. I'm going to ask you really quick a question, because I was recently asked to do you know what a stitch is? Don't worry if you don't, because I did not know what a stitch was. It's a TikTok term,
Okay.
and it's where you see a video and you want to respond to that video. And so they do what's called a stitch, and it's a feature, um, and it's a social media tool. So the social media team said to me, "Cara, would you stitch this video?" Of course, like I was like, "Sure." I had no idea what they were talking about, and so they kind of schooled me and told me, "Okay, well, you just have to come in and we'll videotape you doing this, and then we'll stitch it for you." And so basically, there was this video that had gone kind of viral on TikTok, where a woman who was a nurse, not a nurse, sorry, she was a patient. She had looked up and she was videotaping this. She looked up and there was a camera up there in her room. And she said, a nurse just like came on and
Yeah.
said, "Hi, I'm your nurse so and so today,
Right.
and I'm just checking in with you. Wanted to see," and I guess her face like came up on the screen, and she could then see the patient's
Yeah.
looking at her. And she said, I'm the patient made the assumption that they were, I think, didn't have enough staff, or that they had now
Yeah.
pivoted to having virtual nurses as opposed to real in-body nurses. and
Right.
And so I did like comment. I made like a video comment to this woman's video post that she had done on TikTok. And I said, look, there is definitely, I don't want us to get super concerned over, oh my gosh, we're not going to have in body nurses or in person nurses anymore. We're not going to have, I think that we're just starting to get really smart about how we can utilize people. And
Right.
there is a lot of nurses who have 20, 30 years of experience who maybe they don't want to necessarily be doing the floor grind anymore, and they
Right.
don't want to be working that 12-hour shift on their feet anymore. Or maybe we can even extend these opportunities to people who have disabilities,
Right.
who maybe have gotten injured on the job and they can't physically do that, but they still have all that 20
Yes.
years or, more of information in their brains
Right.
where they can be a benefit
Yes.
to the care of that patient, and be able to spend some time, learning about the patient, maybe learning about, you know, how like the social determinants of health, like maybe just like, okay, like I think that this person might have these things
Hmm.
that they're dealing with, or even things like that. And stuff that like maybe like a bedside nurse just isn't going to have the time to
Yeah.
do. Doesn't mean that they're not going to do like a head to toe assessment or something, but
Right.
there's a lot you can see
Yes.
about a patient without even putting your hands on them.
Right. Yeah, I mean, communication is absolutely critical when it comes to the patient experience, and this gives them another touch point. Every encounter, I always say, every encounter matters, every touch point matters. And if you can provide additional touch points where you can communicate, have that listening two-way communication that occurs, there's a lot of things you can pick up on just through, and maybe that patient may not remember at the time that the physical nurse comes in, but there's different components that they may share with the virtual nurse who is present on the monitor. So I think it's a great extension. We used to call nurses physician extenders, those nurses who work for physicians, and this is almost an
Mhm.
extender of the nurse um,
Yeah,
in that relationship. Yeah.
absolutely. And I know that there's been some talk. I interviewed Bonnie Clipper a while back. I'm
Oh,
not sure.
yes,
Oh, I
yes,
love Bonnie Clipper.
yes.
She's amazing.
She is.
Just her innovation, and she's just always so forward thinking.
Yes.
Uh, but we talk a little bit about virtual nursing and stuff like that. Um, but I think what's really interesting is that you are doing a type of remote nursing that is it's different from, you're not necessarily doing that type of remote nursing where you're
Right.
providing clinical care remotely
Right.
to some extent.
Yes.
So I wanted to ask you a little bit about, just in your opinion, how you see like the different areas of remote nursing, and if you're a nurse, like where could you see yourself going, or where are the opportunities?
Oh, that is a loaded question, Cara.
I know. Sorry, that's my job. It's my
No,
job. Bring it. Like, here, just load up this truck with
right.
all of that information. You're probably not going to hit all of them, but I think there's a
Sure.
lot of different areas where nurses could potentially see themselves doing
There
remote.
There are so many opportunities. My goodness. I mean, I know way back in the day, I had only hoped and dreamed for the opportunities, outside of the bedside, because you do get burned out. I mean, there are some nurses who stay at the bedside their entire career, which is fabulous. It's fantastic. But I think in today's agile work environments, there's certainly a lot more stressors placed on nurses, especially new nurses, and so they're always looking for, how can I grow in this career? How can I extend, maybe stay in the specialty area? What are the opportunities? And there's a tremendous amount through technology that we didn't have back in the day. There are, for example, an ED nurse can go into triage, telephone triage. There's a lot of triage opportunities through various venues and vendors of technology. that they can go and expand and grow and expand. There's the world of academia where you could actually go in and be an adjunct faculty, through online academia. You can go into healthcare education software, such as the space that I'm in, where you can actually go into a consultative role and be able to expand your skill set and give back in that capacity. Nursing informatics, recruitment, telehealth, insurance companies. There's a lot of different avenues via insurance companies, legal nurse consultants, going into being a claims reviewer as well. Virtual preceptorships. We're seeing this. We're seeing healthcare and hospitals really embracing different ways to expand a nursing role. There's a gig nursing that we hear a lot about. So nurses are kind of looking for those opportunities that are interested in a remote capacity, if you will. Virtual nursing certainly to support some of the newer staffing models that we're seeing out there happening. And then, of course, as you advance skills, the opportunities open up and expand. And I haven't even begun to name all of them, but those are just a few ways that nurses can really expand into remote nursing.
I think that this is an exciting time.
It
think.
is. Yes.
Because in my opinion, take it for what it is.
It's very valuable. Absolutely.
But I really do feel like so many nurses want to stay in the profession.
Yes.
And for a variety of reasons, which we've gone into in almost every episode of NurseDot, that we do not need to belabor here, but that we are hungry for another option.
Yeah.
And especially people who've been in it for a while, who, I know that during like COVID, for example, there was all these people that were moving, not in nursing, but all these other types of professions outside of healthcare were moving into these very, very remote roles.
Yeah.
And people were, doing Zoom meetings. And I used to laugh and joke with my wife. I was like, yeah, that's not happening over here. I was like, I can't just, teleport my Star Trek self
I love it.
over into the hospital or home health, or at the time I was seeing a lot of patients at home. And I thought, wow, wouldn't it be nice? But interestingly enough, we did start using a little bit of kind of virtual nursing, if you will, even in the hospice, the home health, like hospice space where I was in. Like suddenly it was okay or acceptable because some patients, especially ones who were very fragile, a lot of like the hospice patients, their families were like, no, we don't want anyone coming in the house. It's a bubble. And we don't care that you're the hospice nurse.
Yeah.
We don't want you coming in because you've been seeing a lot of other people and we don't feel safe that you're coming into our bubble.
Right.
And so suddenly it was like just we had to figure out a solution, and we didn't really have anything like really in place. We had to be able to check in with these people and find out what was going on, and if we needed to do refills of medications, or if there was enough, or if there had been any significant changes in the patient's condition. And so we would start doing just FaceTimes, like just basic FaceTimes, which was, or just making phone calls and saying, okay, this is your check-in and we're calling you. And And, it makes you realize that, like, well, do I have to drive around as much as I used to drive around? And do I have to, in every situation, do I have to be there in person? Or am I able to provide a certain level of resource and, to these families from the comfort of my own home? And I do think that COVID actually opened that up for a lot of different industries that had not really entertained it before,
Right.
but
Right.
out of need, we
No,
had to
you're
do
right.
it.
Business necessity drove a lot
Oh,
of
I
that.
want to make
And
sure I didn't lose you. Oh, there you are.
am I here?
Oh, sorry. Go. You just broke up. It's technology. It's okay.
All
You broke up
right.
for a second, but go ahead.
No, I completely agree. Business necessity drove a lot of that during COVID. We saw some concessions being made from the regulatory bodies around, how to navigate through so that care continuity was delivered. And I think that's when really technology was embraced, so that and now we're still seeing some of that continuing even outside of the pandemic, as because we had some great outcomes come through as a result. And we have hospital at home, we have a lot of different, we've got virtual ICUs. There's a lot of different
Talk
ways.
about that a little bit more, because I don't know too much about that. Tell me a little bit more
Yeah,
about like
well,
that.
it's where the nurses really provide oversight. So as a registered nurse, as you know, we provide oversight of the plan of care, but it's actually where you can deliver some of that care virtually, where they have the necessary equipment in the homes, and that the nurse is really still able to provide oversight to that. So
Wow.
I think there's some opportunities. So we've got a lot of different models out there right now. Johns Hopkins has a great one that they've had in place for even pre-pandemic. Yeah, so there's a lot of,
Wow.
and I think they still, if they still have it, I think they had it on their site about a year ago. But you can actually go in into their site and take a look at what that model framework looks like. But there's a lot of innovation that's occurring because of technology. I only anticipate that through generative AI and the expansion of AI, we should proceed with caution. I'm going to always say that. But at the same time, there are places for that. But I will also say we will never be able to fully replace a human, and especially
No.
a licensed clinician. So I want to make sure that I'm always pulling that into the conversation, that it's only to complement what we do, but we have full oversight when it comes to the plan of care there.
Yeah, because that goes back to the art the art of medicine, right?
Yes,
And I really think that it's the people.
it
It's the
is.
it's the people that bring in the art of medicine.
I love that. That's absolutely true. When we think about structures, processes, outcomes, you can't eliminate people as part of that equation. So,
No, no,
absolutely.
you can't, because there is no substitute for just the energy that you bring into a room,
Right.
the ability to hold space for people,
Yeah.
the ability to show kindness, and
Yes.
how that
Empathy.
results in empathy, how that results in healing. Like
Yes.
we've seen that, just how someone is cared for, and
Right.
the energy and the positive energy that's directed at them and towards them,
Right.
that does actually have it's rooted in science, that
It
there
is.
is that there is an effect to that, and that can't be done by anything other than a living breathing
Right.
person, or I do think like animals too. I mean, like there's
Sure.
there's that benefit of pet therapy and all of that stuff, but also those pets are brought in by people. Like they they don't walk in all by themselves.
Right.
So,
Right.
and if they do, that's questionable.
Right.
So, but
Right.
like it's I do think people get afraid or fearful of, like, oh my gosh, I thought my job was
Yeah.
um it was technology proof or something, like I wasn't going to get replaced by by technology.
Yeah.
And I feel strongly the same way you do, that I think it's really important to say, like, yes, we proceed with caution and we make sure that we're always keeping patient care and patient safety of top of mind.
Yes. Yep.
All every step of the way you have to put it up against, is this helping to
Right.
improve patient care? Is this making it more safe, or is it making it less safe?
Right. Yeah. Absolutely. And there's the emotion. We think Maslow's hierarchy, right? We've got to have, we've got to be able to meet the different elements of Maslow's hierarchy. That will never really go away. That's just the human, that's what we need as humans. And thinking about interpersonal relationships, the two-way, being able to pick up on social cues, or being able to pick up on things that the patient may be experiencing, that person-centered care, in the emotional intelligence that's required behind that, really the compassion, empathy, all should come from, and humans are best in delivering that. So
Yeah. And even if you're delivering it through a screen,
yes. Oh yes.
you know,
Yeah.
I mean, we know that it was, you know, it's not ideal. I mean, I think sometimes in certain situations there's no substitute for being able to put your hand on someone's shoulder or hand
Sure.
them a Kleenex, you know, because
Right.
they're crying, or hold their hand. You know, that's something that you can't do from a remote
Right.
place. But you can look in someone's eyes and you can listen
Mm-hmm.
and you can have undivided attention, which I think sometimes is very hard when you're at the bedside and the bells are ringing and your phone is going off and
Right.
someone's calling from another room or pulling you out of that room to go somewhere else. There's something really nice about the idea of being able to be remote,
Yeah.
not getting pulled somewhere else, and just being able to be really present.
Right.
That's got its own gift in a way.
It does. I think one consideration on the between the virtual nurse, um, there certainly should be a structure and a process where they're communicating any relevant information to the care team that's there, on
Yes.
site. That there's this handoff, if you will, if they pick up on those cues. And I know you probably remember, we were in our academic programs in nursing school. Therapeutic communication was always highlighted. Being able to
Yep.
have that two-way conversation, asking those open-ended questions to learn more, but also being able to relay that information to the appropriate
Yeah. I mean,
people.
think about how nice it is, like when we have Copilot, like
Yeah,
here as a part of our Microsoft Teams, right? We have Copilot and you turn it on, you turn on the transcript, and then it kicks out an abbreviated like notes of your meeting. Well, I mean, that's a good use of AI, right? That's that if as long as it's pretty um exact, like it is not, as long as you've looked at it, I think as a nurse, the person who was on that call, they should be like looking at it and saying, yeah, this is a good representation of what we talked about, and the takeaways are there. All the
right.
good takeaways are there.
Yeah,
And then sharing that information in the patient's chart with the nurse that's
right.
at the bedside, with the doctor, making sure that everybody has that information.
Yeah.
But there's great ways of being able to utilize AI.
You brought up a really good point around, you brought up several good points, but one I wanted to circle back on was, AI is not 100% accurate. And we say, okay, it's gonna learn, but ultimately, there should be oversight. And when we think about proceeding with caution, making sure that the licensed individual, that oversight is going to be required by a licensed individual in the care. If it's ever pulled in to the care process at any point, ensuring that there's someone looking at it for accuracy, because we know we're seeing it in news channels where, news transcripts where AI is being used, it'll say this is, created by AI, and we find typos, we find inaccuracies where words are used inappropriately in a sentence structure. So it's definitely important to have that human oversight component.
Yes. Yes. Because AI is really designed to allow us to do some things
Yeah.
faster.
Yes.
And I think that's great. I think we can all benefit from something a little bit faster, and maybe
Right.
being able to utilize technology so that we can do what we're really good at,
Yep.
and then allow AI to do essentially what we would kind of consider busy work, you
Right.
know? And but I think the danger there is where we talk about, you get lazy, or you just kind of go, oh, it's fine. I'm
Yeah.
sure it's right.
Right.
And we don't have a process for making sure that, like, okay, well, if you're going to have to sign,
Yes.
you have to put your name to that.
Yep.
So make sure that if you are putting your name to that, that you actually feel confident that, what's in this document or in this, you know,
Right.
uh, chart, or wherever you have this information, that you feel that it accurately represents what it is that you're trying to um, convey or
Right.
share with
Yeah.
this team of healthcare practitioners.
Absolutely. And that's one of the things that we're finding in healthcare. At least the key theme is around AI. It's being used to reduce those administrative burdens. So just as you mentioned, so
Yep.
that they can really function at the top of their license. The clinician can function at the top of their license. It's removing those tasky kind of things that tend to take up our time,
Yep.
for sure.
Yeah, absolutely. It's definitely that balance. It's consistently, I think, a balance. And like we were talking about earlier, just making sure that you're always putting it up against, is this helping to provide safer
Right.
patient care,
Yep.
or does it potentially degrade um, our ability to provide safe patient care? And I think we always have to ask ourselves about that. Like,
Sure.
it's but like we were talking about earlier, I do think that it is an exciting time, and I think that we will be able to explore more ways to be uh, benefiting from nurses who are also, uh, maybe physically not able to do the job.
Absolutely. I think there's a lot of opportunities in that space because, let's face it, nursing can be physically demanding over the years. Your back can, I mean, I'm just throwing out a few scenarios, but, feet, back, hips, knees, I know I have a lot of colleagues who've physically been impacted just over the wear and tear of the years. And so, in the lifting, of patients turning, and, even though we use the best of ergonomics and back safety strategies, things happen. And so, there's a lot of opportunities there. I would love to touch on too, when I transitioned over to remote, there was an enormous sense of, I had a teamwork, had an instant team available to me, anywhere I went, where I was in the office or whether I was at the bedside. When you're remote, you don't always have that camaraderie that you would have, at the bedside or in another, if you work in an office or a managerial role. And so it's critically important to think about not only self care, making sure that you're incorporating that as a habit, but ensuring that you have a network, of colleagues, preferably those who are also remote, but a network of colleagues that you stay in touch with so you still have that collegial relationship and you can have that support that you're
That's
going
a
to need.
really important thing that you're bringing up, and I I hadn't even really thought about that. And you'd think I would because I'm pretty remote these days. But now that you mention it, even my own physical health took a toll. I was more sedentary. I kept getting these
Yes.
messages on my iPhone that said, "You haven't closed your move ring today." And I was like, "What?" And I was like, "I
I
haven't
get
even
those.
seen that notification," but I was like, "Clearly I haven't done something." It's like, "You need to stand up." Um, and so it's got its own level of like, now you have to
Yeah.
make sure that you're managing those things and that
Right.
you are getting enough time and that you're walking and that
Yeah.
you're going outside. Like
Yes.
sometimes I'm like, did I go outside today? Like, and also like I got really bored at my own house. Like I was just like, I have got to get out of here. And then like my spouse gets home from being
Right.
out all day and I was like, oh no, I have got
Right.
to leave.
Yes. I know. We're going out. I
And they're
get
like, but I just got home. And I was like, nope, we're going out.
right. Right. No, I'm with you. It's like I've been in the house all week. I need to get out. It's not
Yeah.
good. Or I've missed this whole 76-degree weather day with sunshine because I've been,
Yeah.
connected to a computer all day, basically.
Yes.
So it's
And
important.
that's something to be mindful of as well. Like looking at a screen.
Yes.
That can be
Yeah.
tough.
Yeah.
So yes, you have to mix it up. It can sound really wonderful, just the idea of working from home and maybe not wearing pants.
Right.
Like,
Right.
I mean, I'm not saying that that's what we're doing. I'm just
Right.
saying that, people talk about like, well, they can only see you from the waist up. So what you're wearing down below, who cares?
Right.
You know,
Right.
so it can seem kind of appealing when you've had to go out into the workforce for a long
Yeah.
time and you have to get ready and you have to put, get, new clothes all the time and all
Yeah.
that stuff. But, it has its own level of being a little tiresome sometimes. The grass is not always greener on the other side,
It's
is what we're
it's
saying.
not. And it just brings back, I mean, even though I've been doing this for what, let's see, roughly 18 years. When I first transitioned, I wanted to be sure I put in some self-discipline components. So I would dress up like I was going to work every day, and I would start my day at the same time I would be at my desk because I wanted to just make sure that I kept my work habits. But I will tell you that I am much busier working from home or working remotely than I ever was in an office because you don't have any distractions. So you have this time to do even more work and get even more done. And I'm much, much busier than I was ever in an office setting because you have, people coming in and they're talking to you, you're taking breaks, you're going to the coffee machine, or there's things that you do that you don't necessarily do here, or,
Yep.
remotely.
Yeah,
So it's
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 true.
definitely busier for me, I have found. And you have to be sure you cut it off at the end of the day. That's another thing because it's always
Yeah.
available to you. There's always that
Hmm.
temptation to go back and do one more thing or stay a little bit longer. So
Yep.
it's important to put in self-discipline.
Yeah. Those are all really great pieces of information, I think, to add to this picture, because I think it can seem we can romanticize it, right?
Yes.
I think that
Yes.
we really can. And especially if you have been a nurse for a lot of years and you're thinking, oh my gosh, what I wouldn't give to stay home and be able
Right.
to just open up a laptop and that start my day and close it and
Yeah.
I'm done,
Right.
and I get to eat and I get to go to the bathroom when I want to. It's
Right.
like,
No waiting 8 hours before you go.
all the things that sounds very appealing. And it is like, but I do think that just like with anything, it's
Yeah,
about balance,
it
right?
is.
And it can have all of those wonderful aspects to it. And then there's like what you're saying is an element of self-discipline
Yeah.
that goes into that as well. So I think that we did a really great job of painting a very full picture for the audience of all of the opportunities around. I mean, we probably didn't touch on all of them, but you shared a lot of different opportunities for remote nursing.
Yeah. And it's going to grow even from there. Like, that's just today. But as we think about AI, as we think about the expansion of technology and expansion of technology in healthcare, I mean, it's only set to grow even more. So, just a tremendous amount of rewarding opportunities like never before that we've seen in the profession. So it's an exciting time.
It is an exciting time. Well, I think that is an incredible mic drop, Felicia Sadler.
Thank you, Cara Lunsford.
You're welcome. Well, as always, I love talking to you, and you were the perfect guest for this episode. And I think that people are going to get a lot out of it. So thank you again for coming and joining me on the NurseDot podcast.
Thank you for having me.
All right. Talk to you soon. Have a great weekend.